honor to deliver this statement on behalf of the Group of 15, a group of developing countries representing Asia, Africa and Latin America, which aims to foster mutually beneficial cooperation and collaboration, especially in the sphere of South-South Asia, Africa. Mr. President, the Group of 15 views the 2030 Agenda for Sustainable Development as a plan of action for the people, planet and prosperity, built on the three pillars of social, economic and environment of the Sustainable Development Goals. The foreign ministers of the group have identified the 2030 Agenda for Sustainable Development as a key global process for the G15 to be involved and contribute to its implementation as a niche group, the Global South. The group sees the implementation phase of the agenda as critically important and calls for enhanced commitments for focused and action-oriented plans that achieve the targeted goals within the SDGs. The group takes note of the report on the progress in the implementation of the 2030 Agenda for Sustainable Development presented to the World Health Assembly. In this respect, the G15 is committed to enhancing capacities for sustainable development through robust South-South cooperation initiatives and also opportunities to the WHO. In this regard, the G15 wishes to engage with the WHO to seek opportunities for training and capacity building for its member countries, which would offer tangible benefits. This could be done in partnership with other international and intergovernmental organizations. The Group of 15, having identified migration and development as one of our 4 key areas of focused cooperation, calls for greater engagement in migrant health of developing countries. The group seeks avenues for policy coherence and international partnership for the betterment of health conditions for its migrant population. In this regard, the group wishes to request that the health dimensions of the migration be reflected in the final document of the Global Compact on Safe, Ordered, Regular Migration and calls for WHO's greater engagement in ensuring that. The group notes the ambitious target of ending epidemics of AIDS, tuberculosis and malaria, while calling for vigilance for threats posed by increasing resistance to antimicrobial drugs, including multi-drug resistance, malaria and HIV. The group welcomes the adoption of the political declaration on antimicrobial resistance following the high-level meeting General Assembly last year and hopes that the political commitment would contribute to strengthening antimicrobial stewardship and calls for greater partnership in this regard. The group reiterates its views that health research and development should need driven and evidence-based and be guided by the core principles enunciated in the consultative expert working group. The group extends its support to the WHO Global Strategy and Plan of Action on Public Health, Innovation and Intellectual Property and call on that the strategy also includes implementation means of the recommendations of the report of the United Nations High-Level Panel on Access to Medicine. The group recognizes the PIP as an important framework for an effective disease surveillance and appropriate response should be updated to keep abreast with the technological advancement, in particular to include an appropriate exchange of generic sequencing data for an enhanced disease surveillance. Finally, the group reaffirms its firm conviction WHO's leading role in shaping global health policies and in engaging and coordinating global health partners. Our group further encourages the WHO on its continued commitment to achieve the 2030 Agenda goals. Thank you very much.
Thank you very much for your statement. I give the floor to the delegate of the Philippines, and I invite the delegate of Chile to come to the rostrum.
It's okay. Thank you, Madam President, Director General Chan, Excellencies, ladies and gentlemen. The Philippines joined the Assembly in condemning the act of terrorism in Manchester last night. The 2030 Agenda for Sustainable Development This bold journey that we have agreed to pursue means nothing if not transformed into concrete action. Health outcomes cannot be improved unless they are founded on the firm foundation of resilient health systems. Fueled by the President Rodrigo Duterte's trust to uphold the constitutional right to health of every Filipino, with Ambisyon Natin translated, our Ambition 2040, as our long-term goal, and the Philippine Health Agenda 2016 to 2022, with battle cry, all for health towards health all, underpinning the principle that health is everyone's concern, with the following priorities. First, build strong health systems. We have a modest aim of having at least one health worker per village to cater to the primary health care needs of the community, given our strength in human resources for health. We envision a country where every patient feels respected, valued, empowered in all interactions with the health system, regardless of population group and across the life course. Second, achieve true financial risk protection, especially for the poor. 92% of the population and counting are already covered by the National Health Insurance Program. Benefits shall be expanded to cover comprehensive range of services with high support value, including programs for migrant Filipino workers. We aspire to make social protection accessible for all and shall encourage the formation and strengthening of health service delivery networks to improve gatekeeping and patient referral systems. Third, the passage of landmark health laws. The Syntax Reform Law, which has put in place a unitary excise tax on tobacco and alcohol, generated revenue, allowing the health sector greater fiscal space. The Responsible Parenthood and Reproductive Health Law, which empowered the people, especially women and the youth, through informed choice and age and development appropriate education, ensuring sustainable reproductive health programs are in place. We look forward to continuing our partnership with the legislature, civil society, towards regulatory reforms to prevent and control non-communicable diseases by introducing limits to sugar and salt, keeping in mind that all these are health policies with a tax revenue component, which would result in a win-win situation for the country. For health laws, we are also pushing this agenda at the executive level. In January, President Duterte passed EO 12 on zero unmet need for family planning. And just before I left for this assembly, the President's Executive Order 26, which imposes a nationwide ban on smoking in public and enclosed places and conveyances. We will also ensure that our commitment to the Paris Agreement and the Sustainable Development Goal 13, which focuses on climate action, be integrated in our national policies, recognizing this treaty as a health treaty and making resilient health systems as one of the landmarks of its implementation. Madam President, Excellencies, the Philippines has a young population. 31% of our people, or 32.7 million Filipinos, are aged 14 years old and below. This fact informs our policies to be geared towards the protecting the interests of the youth as a vulnerable sector, towards healthy lifestyles, away from the dangers of substance abuse, leading to impairment and social decline. I wish to thank, at this point, Director General Margaret Chan, a daughter of Asia-Pacific region, who, through exemplar leadership, leaves us with tremendous legacy of progressive developmental mindset. We have heard your call, especially on remembering the people, and resources are our best assets in the health system. And take this to heart, Director General Chan. We health ministers are here today in pursuit of our mandate to look out for the well-being of all people. as it is our humanity and our desire to attain the best possible health outcomes for all. Your Excellencies, the WHO for the past decade will continue to be our guideposts as we write the next great chapter in the history of public health for the 21st century. We commit to support the next Director General, whom we will elect today, towards a healthier people and planet. Many thanks, mabuhay.
Thank you. I would like to remind all delegates to keep the time allotted in mind. I give the floor to the delegate of Chile and invite the delegate of the Russian Federation to come to the rostrum.
Director General, Ministers, ladies and gentlemen. We'd like to extend our support for the people of the United Kingdom. We reject the terrorist which just took place there. On behalf of the President of the Republic, Dr. Michel Bachelet, I'd like to make this statement on public health policies. For Chile, public health policies are very closely linked to the Sustainable Development Objectives. And this represents an opportunity for us to improve systems, improve coverage, and put the emphasis on intersectoral approach. I'd like to pay tribute to the work of Dr. Chan as Director General. Chile is determined to build comprehensive health systems with prevention, treatment, and rehabilitation taken into account, responding more effectively to the needs of our people, including living in healthy environments. We have structural policies that attempt to change lifestyles and behavior. In particular, for example, we try to deal with obesity and smoking. Like other countries, our country has seen epidemiological changes relating to overweight and obesity. We have one of the highest rates in the region of obese children, 10% of under fives. A third of that age are already overweight. In order to try to rise to that challenge, we've adopted a law on the are already overweight. In order to try to rise to that challenge, we've adopted a law on the food components of food with clear labeling indicating the number of calories, the number of saturated fats, and that is an approach which has been defined by the Ministry of Health. We also prohibit advertising focusing on children and the sale of such products in schools. The Ministry of Health has implemented these regulations with a good, wide, broad participation throughout the process. 6 months after implementation, we've seen now that the population is fully supporting this policy and is in a position to follow it. The food industry is complying with the law, producing foods with less calories, less saturated fats and sugars. And we hope that in the next few stages we'll continue to see significant changes in the eating habits and in the behavior of our population. We'd like to thank FAO and PAHO, who in July 2016 recognized Chile's efforts in this regard and supported our policy. A second policy on tobacco use. We realize that 25% of school children between 13 and 14 were smoking. And Chile, with the support of WHO and the Convention on Tobacco, have been adopting new policies, and we've carried out a survey in 2016 where we've seen that this has fallen by 9% now in the general population. So we are trying to combat tobacco use, and we are trying to introduce plain packaging for tobacco products. Studies show that plain packaging shows that it can have an impact and raise awareness of the risk in the general population. We'd also like to ban the use of menthol in tobacco products and combat advertising, because it has been shown that smoking menthol-based products increases the amount of smoke being inhaled. We continue to adopt public policies which try to improve the well-being of our people. We see health as a social right, so we need to improve our health systems to respond to the needs of all, so that we leave nobody behind. Thank you very much for your attention.
Thank you very much for your attention. I give the floor to the delegate of the Russian Federation, and I invite the delegate of Indonesia to come to the rostrum.
Уважаемые коллеги, делегация России присоединяется.
Colleagues, we align ourselves with the statements that have been made in terms of the condolences and the support that we would like to offer to the government of the United Kingdom and Northern Ireland. With regard to the tragedy that took place last night in Manchester. Vice President, colleagues, first of all, we'd like to express our gratitude to the Director General of the WHO, Dr. Margaret Chan, for the comprehensive report. We are satisfied by the results that have been achieved by the WHO. On this anniversary, we should be proud of the progress that we have achieved in terms of humanity and the progress in terms of health. We are health as the mental and physical well-being of a person, and in this broad concept we have included, this has also been included on the 2030 Sustainable Development Agenda. Russia was among the member states to look at approaches to improving health systems and combating the burden of non-communicable diseases in terms of prevention. Despite the lack of funding for programs on non-communicable diseases, our organization and member states have done quite a lot. With the support of the WHO, we have adopted strategies and plans of action strengthened through national legislation in terms of improving health and improving the life expectancy of citizens. And together with WHO, we are working on technical issues, and we have managed to reduce our death mortality and death as a result of alcohol, and also maternal and infant mortality, and also the mother-to-child transmission of HIV. We have adopted strict laws on alcohol. We have strengthened legislation in terms of alcoholic beverages and nutrition. We have made huge steps forward to create a healthy environment in cities, and we have offered opportunities for citizens to visit health clinics. And we have a lot of experience in terms of preparedness and response to emergency situations. Proof of this is the fact that the WHO has certified field hospitals on their registry, and we would like to thank them for the trust that they have shown in us. And something else that is extremely important is health evacuation during emergency situations, particularly when it comes to a large number of victims and countries with vast territories. We need to work on unified international requirements for training and equipping air medical specialists and implementing the necessary procedures for WHO certification of this registry. We are ready to work with the WHO and to work on certifying air medical teams. Colleagues, the Russian Federation regrets the confrontational statement made by the representative from Ukraine, particularly given the fact that it did not contain real facts. This is not a constructive debate. And I would like to conclude on a positive note. I would once again like to thank all WHO workers, the Director General, Margaret Chan, for continuing to try and achieve the excellent goals of this organization, and allow me to wish everybody success in their work at the 20th World Health Assembly. Thank you for your attention.
Thank you very much. I give the floor to the delegate of Indonesia, and I invite the delegate of Senegal to come to the rostrum.
President of 70th World Health Assembly, Excellencies, Minister of Health, distinguished delegates, I would like to express my deep condolences to the government and people of the United Kingdom for the heinous act terrorism occurred last night in Manchester. Ladies and gentlemen, on behalf of the government of the Republic of Indonesia, I would like to congratulate you, Madam President, on your assumption as the President of the 70th session of the World Health Assembly. And I would also like to express my appreciation for the leadership of the 69th Presidents of the World Health Assembly. Indonesia recognizes that the world is making progress toward the achievement of the Agenda 2030. Indonesia has aligned the SDGs with national policy by mainstreaming of the SDG into national program through the Healthy Indonesia program. In line with the aspiration of the SDGs of leaving no one behind, the government of Indonesia implements a number of breakthrough programs and intensified effort to implement the National Health Insurance, which was launched in 2014. Currently, the National Health Insurance Scheme covers approximately 175 million people. Indonesia remains confident that we will achieve the universal health coverage by 2019. To hard-to-reach area, the government of Indonesia launched Healthy Archipelago, or we call it Nusantara Sehat, in 2015. The program aimed to meet the need for health personnel in borders and remote islands. More than 1,500 interprofessional health workers have since served in more than 300 health centers. For service in referral hospital, specialized doctors are also deployed to various locations. Excellency, ladies and gentlemen, the recent multiple occurrence of health emergency have taught us an important lesson. We need to continue to strengthen and increase the quality of the national health system, which can withhold unpredictable events of emergency. We wish to underline the development of National Action Plan on AMR as mandated by the WHO Global Plan. Indonesia in this regard has recently finalized the National Action Plan on AMR, which will be placed in a joint regulation between Minister of Health, Minister of Agriculture, and other related ministries. Furthermore, ensure multi-sectoral involvement in the implementation of One Health approach. Indonesia has prepared a presidential decree on the National Working Group on Global National Health Security. In this occasion, I am pleased to announce that Indonesia is in the pipeline to conduct joint external evaluation in November 2017. Finally, as part of our commitment to harness resources and collaboration to accelerate SDGs achievement, Indonesia will host the first Asia-Pacific Food Forum in 30 to 31st October 2017 in collaboration with its foundation. This forum will force as a regional catalyst to tackle development challenges through food system. Let me conclude by expressing special appreciation to Dr. Margaret Chan for her commendable leadership as the Director General of WHO and 10 years of profound dedication in advancing the global health system, as well as for her continued support to all member states in advancing our health status, including Indonesia. I thank you, John. It is my fervent hope that the next Director General can continue the legacy to strengthen the role of the WHO as the leading health organization. Indonesia stands ready to support the incoming new Director General of the WHO throughout his or her leadership. Thank you, Chair.
Thank you. I give the floor to the delegate of Senegal, and I invite the delegate of Vietnam to come to the rostrum.
Monsieur le Président,
Vice President, Director General, Excellencies, Ministers, and distinguished delegates. Like my predecessors, my delegation would like to condemn the attacks that took place yesterday in Manchester. We would like to offer our condolences to the British government and to the families. We would also like to offer our support to Director General Margaret Chan, whose leadership and commitment has provided us with considerable results. Senegal is delighted with the relevance of the theme of the Assembly of the 2030 Sustainable Development Agenda, and to build better health systems. This theme is relevant, and it invites us to consider the ways and means to better respond to population's health needs and public health threats which continue to increase, as well as to... We have also identified 3 aspects of this theme which are fundamental and would like to share with this august assembly. These 3 aspects are, in our point of view, interconnected, accumulative, and extremely important in terms of moving towards the 2030 program. It places individuals at the heart of health access, and it respects the human right to health, and it makes our health systems resilient. Placing individuals at the heart of this program and of public policies in healthcare needs to take into consideration human and social aspects. In Senegal, the reference document for economic and social policies is fully aligned with the 2030 Sustainable Development Agenda, because in Pillar 2, Human and Social Capital, my country has created a strategic line between the targets of the SDGs and our planned policies. And we can also note that SDG 3 allows everybody to live in good health and promotes well-being for all throughout the life course. And this has also been taken into consideration in terms of the priorities of the of our current program. And health actions need to be guided towards meeting the needs of the population and having broad health coverage. Senegal has finalized its health roadmap, and particularly when it comes to a lack of human resources, but there are certain challenges, particularly when it comes to hospitals, and this needs to be did. Respecting and acknowledging the human right to health, taking into consideration the social dimension of healthcare, and combating inequalities in the health sphere is a priority for us to be able to achieve SDG number 3, and Senegal has put into place a universal health coverage agency which shows the political will of the highest authorities in our country to ensure financial and social protection for the population in order to meet their needs, whatever their economic and social status may be. And in order to do this, by 2017, 75% of the population, particularly in informal and rural areas, will have health coverage, and it will also provide the most underprivileged and persons with disabilities to gain access to this healthcare, and as well as children under the age of 5. And we have recorded a positive development in terms of the coverage rate from 20% to around 46%. And this was from between 2013 to 2016. We are working on a funding strategy as well at the moment. Making our health systems resilient and combating Ebola and the resurgence of other diseases and other public health threats have shown the fragility of our health systems. And this may be an obstacle to achieving the 2030 Sustainable Development Agenda. And we also have a One Else strategy, and we have emergency operation centres, which are the focal point within our country. And we also worked on other programs which will help to building a sound healthcare system, and we are committed to combating legal barriers linked to intellectual property when it comes to obtaining medication, and also combating false medication so that we can stop neglected diseases, tropical diseases, communicable and non-communicable diseases, and we're also looking at research and development in this area. Vice President, ladies and gentlemen, the 2030 is already on the horizon, so we need to think globally and act locally. Thank you for your attention.
Thank you. I give the floor to the delegate of Vietnam, and I invite the delegate of Portugal to come to the rostrum. May I kindly remind the delegates, please, to keep the time in mind.
Member States, distinguished ladies and gentlemen, first of all, I would like to express our deep condolence to the government of United Kingdom and its victim of Manchester attack last night. I would like to convey our warm congratulations to Dr. Skovsva to be selected as President of the 70th session of the World Health Assembly. I would like to express our warm congratulations and deep appreciation to Dr. Margaret on her successful completion of her terms as Director General of WHO. Over the last 10 years, she has devoted herself for the work of WHO and printed significant milestones in the global health agenda. Vietnam High appreciates WHO's essential role in formulating and developing relevant health policies, strategy, and guidance at global and regional levels. We are in the process of healthcare system reform to build up the health systems that are resilient and responsive to address those challenges in the transition period. Therefore, we recommend the team of One Health Assembly to build up the health systems Vietnam has promulgated the National Action Plan to implement the 2030 Agenda for Sustainable Development, in which the tasks of each ministry and agency were assigned, especially ensuring the whole of the government and society approaches. The healthcare reform process in Vietnam is now shifting the focus towards strengthening the grassroots levels, especially at community health center with people center and high quality integrated care with family medicine principle to address NCD, aging population and community health. At the same time, we also focus on improving quality of medical services at public hospitals, aiming at the patient's satisfaction. Healthcare financing reform is also our main to focus towards universal health coverage. Currently, the health insurance coverage is as high as 22%, in which the government subsidizes for the poor, disadvantaged, and ethnic group minority. Moreover, we have mobilized all resources with strong political commitment about government and multiple sector approach for making all the health policy. We also have developed basic benefit package, essential drug list, and ensure the accessibility of essential drugs, especially drugs for NCD. We also mobilize the resource to To respond to emerging and emerging infectious disease, Vietnam is one of the leading countries in the region to implement the global health security agenda. We will prepare with emerging and emerging infectious disease control and antimicrobial resistance. For non-communicable disease, Vietnam has adopted the national strategy on NCD control, and we have established the fund for tobacco control using tobacco tax, and the laws of the alcohol-related harms is now under development. We would like to learn more experience from WHO and member states on this issue. On this occasion, we would like to spread our sincere thanks to WHO for strong support so far. Vietnam looks forward to receive further support and collaboration from WHO and other development partners in the coming year for building health system. And thank you very much for kind attention.
Thank you very much for your statement. I give the floor to the delegate of Portugal, and I invite the delegate of Sweden to come to the rostrum.
President of the World Health Assembly, Director General, distinguished colleagues, ambassadors, ladies and gentlemen. And at the outset, I would like to express solidarity with the United Kingdom. This is a moment of great suffering as a result of the attack that took place last night in Manchester. I'm honored to speak at this World Health Assembly representing Portugal. I'm speaking to you in Portuguese, the fifth most widely spoken language in the world, spoken by approximately 280 million people all over the world, bringing together countries from all continents, and we do hope that in the near future it will become an official language of the United Nations. Since this is the last World Health Assembly taking place within the term of office of the current Director General, we'd like to pay tribute to her work. Dr. Margaret Chan has put in extraordinary work over the past 10 years, and we'd like to wish her all the best for her future plans. As we are about to elect the new Director General of this organization, I would like to say whoever comes out triumphant in the elections will have a very important and great responsibility to uphold. In this period of humanitarian crises, wars, forced migration, unprecedented numbers of refugees, hunger, violence and discrimination, and new threats to global health, including climate change, antimicrobial resistance, the growing threat of NCDs, the enjoyment of human rights, and in particular the right to health, continue to be denied to millions of people. And so the task for the new Director General will not be easy. The challenges are great, but we also have great expectations. The new Director General will be able to count on the support of Portugal, and we hope to strengthen our cooperation with the WHO, thereby contributing to promoting and protecting public health so that everybody can enjoy the highest possible level of physical and mental health through effective universal health coverage without any type of discrimination, making sure that we have strong, resilient and sustainable health systems. President, the 2030 Sustainable Development Agenda contains a wealth of objectives focusing on human rights, with objectives and targets to help us build fairer and more equal societies without leaving anyone behind. Of course, it's an innovative and ambitious agenda in trying to overcome inequalities and putting people at the very heart of our efforts, building on human dignity and efforts to combat discrimination, ensuring that human rights is at the very focus of all of our states' actions. And this will help us to build a sustainable development with lasting and shared peace. In its main structural reforms, Portugal has been ensuring that this is a key aspect for us, and including in the achievement of the 2030 agenda. What is of great concern to us is sustainability is threatened by inaccessible medicines and very expensive medicines, and hepatitis C is particularly shocking. And that's why we pay we attach importance to the high-level panel recommended by the United Nations Secretary General. And it's very important that these issues connected with access to medicines continue to be discussed at the highest level in the United Nations so that we can deal with this in a cross-cutting and coherent manner. To conclude, I simply wanted to point out that the 2030 Agenda is the culmination of 15 years of efforts and discussion. And we hope that this will respond to all of these great variety of political, economic, social and environmental realities, and that all of us can assume the responsibility to develop plans and strategies focusing on a better world in order to build a more prosperous, sustainable, peaceful and inclusive future for everybody all over the world without leaving anyone behind. And Portugal gives its full commitment to try and fulfill its part in that bargain. Thank you very much.
Thank you very much for your statement. I now give the floor to the delegate of Sweden, and I invite the delegate of the Republic of Korea to the rostrum.
Madam President, Madam Director General, Mr. President, Madam Director General, Ministers, Ambassadors, ladies and gentlemen. First of all, my delegation would like to express our condolences to the victims of the horrific attack that took place in Manchester yesterday. Sweden stands behind the British people in their fight against terrorism. Sweden fully aligns itself with the statement made by Malta on behalf of the European Union and its member states. I have the following remarks in a national capacity. Sweden would like to take the opportunity to commend Director General Margaret Chan for her dedication, her strong leadership, and her goal-oriented work that has led to important results on overall reforms, implementation, and also the emergency reform and the work on AMR. Thank you, Madame Chan. Health is an integrated part of sustainable development efforts, and strong health systems are necessary to ensure good public health and combating the diverse threats to public health today. The World Health Organization has a lead role to play in supporting member states in implementing the health-related sustainable development goals, ensuring health in all policies approach, so that no one will be left behind in attaining the highest standard of health and well-being. To achieve this, we need a strong WHO that is fit for purpose, that in turn requires our continued commitment to the reform process with an effective, efficient, transparent and accountable organization as the objective. Non-discrimination and equality are fundamental aspects of the Agenda 2030. The health targets can only be achieved if we promote gender equality, protect human rights, and report and assess health outcomes from a gender perspective. This conviction is an integral part of Sweden's feminist foreign policy. The right of women to freely decide when and how many children to have, as well as the right to information and quality health care services required to exercise that right, is not something we can take for granted. It is being challenged by many governments to a greater extent today than ever before. To achieve the health-related SDGs, access to health care is essential. This includes access to safe abortion and contraception, as well as to knowledge and counseling on sexuality and sexual rights, not only for girls and women, but also for boys and young men. And we expect the next Director General to demonstrate very strong leadership on these issues. I would like to address one more threat to our common security and health, namely antimicrobial resistance. This is one of the greatest threats to global health, food security and sustainable development. It also has significant economic consequences. The UN General Assembly's political declaration last fall is a huge step in the recognition of the magnitude of this problem. We now have established an ad hoc interagency coordinating group on AMR with a mandate to ensure sustained effective global action. And the evidence for strong response is compelling, and in the past few years we have made considerable progress by working together and developing national action plans to translate the global goals to national action. We must now, in our respective countries and together at global level, continue their implementation, keep a strong focus on our common goals, and build capacities to meet the commitments made. The report of the Secretary General to the General Assembly 2018 must show real progress in the fight against AMR, because in this truly global fight, we either succeed together or fail together. There is no in between. Thank you.
Thank you very much. I give the floor to the delegate of the Republic of Korea, and I invite the delegate of Luxembourg to come to the restaurant.
Mr. Vice President, Honorable Ministers, Excellencies, distinguished delegations. Last night, we lost many innocent lives to a devastating bomb attack in Manchester Kingdom. I extend my deepest condolences to all victims and their loved ones. Let me reiterate to the World Health Assembly that the government of the Republic of Korea stands firm against all forms of violence. Now, allow me to join my fellow delegates to thank Dr. Margaret Chan for her outstanding leadership and passionate devotion to public health over the last decade. During her tenure, tremendous progress has been made. The world has seen a continued improvement in major health indicators, including increased life expectancy and decreased infant and child mortality. WHO has become a more effective, transparent, and accountable organization through the reforms over the last years. More recently, Dr. Chan has created the new WHO Health Emergency Program that has enabled this organization to better respond to emergencies. This remarkable achievement would not have been possible without her dedication and leadership. Despite progress, health is facing new and complex challenges such as climate changes, migration, urbanization, and new pathogens. These issues cannot be addressed by a single country, nor by the health sector acting alone. The 2030 Agenda for Sustainable Development clearly recognizes this. My government has learned it in a hard way from the outbreak of MERS in 2015. Today, I'm proud to speak about how we have changed our ways of thinking for public health. As a result, the Ministry of Health and Welfare is working together with other ministries and various stakeholders. A good example is our multi-sectoral collaboration on environmental health. For protecting population's health from deteriorating air quality, particularly by fine dust, we have considered all relevant factors going beyond the health. From this One Health perspective, my government established a comprehensive national plan engaging various sectors of government. We also had a constructive dialogue at a ministerial level with the neighboring countries. I believe that this can be the right approach to advance the Sustainable Development Agenda by 2030. To achieve 13 health targets in the SDGs, best practices as well as financial and technical assistance should be shared across member states. Public and private partnerships will allow us to benefit from private sector's innovations and hence should be further promoted. In this context, WHO's leadership is more crucial than ever, and it needs the full support of all member states. This year, the Republic of Korea took on the chairmanship of the JHSA steering group. I am pleased to announce that my government will undertake Joint External Evaluation, JEE, in August this year. We endorse the importance of IHR from the One Health perspective and encourage more countries to undertake this evaluation. Based on the report of JEE, countries should be provided with necessary support to fill the gaps in their IHR capacities under strong coordination by WHO. Ladies and gentlemen, later today, we will elect a new WHO Director General. I am confident that the new leader will build on the legacy of Director General Margaret Chan and guide us for protecting health of all population while continuing the reform of WHO. The Republic of Korea reaffirms its full support to WHO, and I am looking forward to working with all of you for building better health system. Thank you. 감사합니다.
Thank you very much. I give the floor now to the delegate of Luxembourg, and I invite the delegate of Colombia to come to the rostrum.
Please allow me to start by joining all the colleagues who publicly condemned the terrorist attack in Manchester. We feel with the victims and their families. Monsieur le Président,
President, Ministers, delegates, my delegation welcomes the fact that the World Health Assembly has chosen a theme which focuses on the construction of new and better systems for sustainable development. If recent crises such as the Ebola crisis in Africa have demonstrated the devastating impact that a serious epidemic can have for socioeconomic infrastructure and the entire health of a country, if not a region, this also recalls the need to strengthen national healthcare systems in order that all countries have solid, resilient healthcare systems that are well integrated. I would like to underscore that Luxembourg, its cooperation with the WHO, places a particular emphasis on bolstering national healthcare systems. A major regional project in West Africa, which was put in place through a partnership with WHO and the European Union, is the fruit of our cooperation in this area. The effective implementation of international health regulations is a first-order priority in this area. What are the lessons of the serious Ebola epidemic? My country welcomes the World Health Organization for putting in place new rules and adapting to the need to respond to such international crises. Such programs are fully supported by Luxembourg, strengthening the bonds between urgent healthcare and national healthcare systems. This is fundamental. Luxembourg places great importance on Homo sapiens and human rights being at the center of the healthcare matrix and human healthcare being an absolute priority. In this sense, my government recently reaffirmed its political support for the importance of healthcare, reproduction and reproductive rights through a financial contribution to the global initiative called She Decides. Luxembourg will continue to work with determination to ensure that no one is left behind which is by fulfilling our national health care policies or by providing technical, political and financial support for developing countries. President, I would now like to place an emphasis on three particularly concerning international challenges. The first is linked to the global challenges of antimicrobial resistance, AMR. I note with regret that across the world the scourge has been underestimated up until now. However, we are happy that this item is now a matter of the highest priority policies across the world. The G20 health ministers met last week, and we hope that that meeting will bring fruit, and we welcome the outcome document adopted in Berlin. We call to all stakeholders involved in this area to focus their work on cooperation. We need sustained, cooperated, long-term efforts. Second, despite the significant progress achieved, the world faces an unacceptable and immense impact from NCDs, non-communicable diseases. Thousands of people are killed in Luxembourg by tobacco addiction, also health impacts through cardiovascular problems are a major challenge in our country. Initiatives have been developed recently. I would like to note responses to chronic pain, oncologic work, as well as human genome projects. A great deal has been done in our country, and we wish to focus on prevention of certain diseases in an integrated approach which is focused on the individual. In the current context, third, the migrant and refugee crisis. European countries face a major challenge in their attempt to integrate the health needs of millions of people in despair, amongst them many women, children and non-accompanied minors. My country regrets that numerous people do not yet have access to health care. This is why Luxembourg supports the creation of a mechanism which will allow the origin, transit and destination countries to exchange best practices and data on patients. My country, with great conviction, supports the creation of a WHO international system in this area. Often there are urgent crises which make the task of the WHO even more complicated. I would like, in concluding, to pay a tribute to Madam Margaret Ann, the Director General, for her leadership and the remarkable work which she completed with all of her team over 10 years at the head of the organization. Thank you for your attention.
Thank you very much. I now give the floor to the delegate of Colombia, and I invite the delegate of South Africa to come to the rostrum.
Gracias, Presidente.
Thank you very much, President. Dear ladies and gentlemen, as a Colombian, I know firsthand the pain and suffering that has been caused by terrorism. My delegation would like to express a deep sadness for what has happened yesterday in the city of Manchester. We reject all forms of terrorism, and we would like to express our solidarity towards the victims. Colombia is looking to the future with hope. After more than 50 years of war, Colombians hope to be able to live in a normal country, a country with significant democratic, social, and economic challenges, but that is pacific and an inclusive country. Colombians would like to leave behind a violent legacy, and we would like to focus our efforts on the difficult task of shared prosperity and social equity. More than half a century of brutal conflict has been seen in Colombia, which is related initially to social exclusion, exacerbated subsequently because of drug trafficking. It has left behind hundreds of thousands of casualties, thousands of disappeared people, and millions of displaced people. Most Colombians have not been able to live through one single day of peace. We have all been affected by the conflict. We all have a tragic history to tell. The conflict affected public health in many different ways. There was violence that was associated with a very slow and emotional development of children, as well as a higher level of aggression of mothers committed against their children. The conflict also affected access to care, health services, and in general hindered a more effective presence of the state in a great part of the territory. The peace settlement that was signed in my country provides us great opportunity to be able to rectify the situation, to be able to close the gaps in all the different healthcare provisions and services between bigger cities and rural areas. A normal country is a country that is able to find a remedy to inequalities in health. This is the main challenge for the years to come in Colombia. There are no more excuses. Maternal mortality, for example, is much higher on the outskirts of Colombia than in the center of the country. And the same thing happens with the infant mortality as well as other public health indicators. Peace settlements in my country provides us with several challenges. For instance, the strengthening of rural health programs, primary health coverage, as well as psychosocial care and treatment to victims, and dealing with the public health outcomes of the drug problem in my country. We have already been able to make a lot of progress. For example, a few years ago, we were able to interrupt the fumigation of glyphosate. We have also implemented a program, a pilot program in the rural areas. However, the new challenges are immense. Normality is faced with many different difficulties. In Colombia, the healthcare system is faced with three main challenges in the process of peace consolidation. First of all, there is the capacity building in more remote areas where the conflict, as I already mentioned, hindered the permanent presence of the state. Secondly, the training and retraining of thousands of healthcare professionals. We still need psychologists, nurses, family medical experts, pediatricians, and other specialists that have the know-how and availability to work outside of urban centers. And third, we need to find a better balance between primary healthcare as well as healthcare for illnesses that are quite costly, illnesses that require a huge amount of health resources. The price of medication to fight against hepatitis C, cancer, and other illnesses threatens the sustainability of our health system, and also therefore threatens our plans and projects for health development post-war. The high prices of medicine could irrevocably delay for a long time the necessary investments for peace and for our country to be able to ensure health equity. The TRIPS flexibilities, the transparency in the costs of research and development are absolutely essential to guarantee fair prices. This organization must play a major role in trying to find solutions to this global problem with incredible local repercussions. The recommendations of the panel of experts that was convened by the Secretary General of the United Nations is a good start. In any case, peace must be irreversible in Colombia. As is highlighted in Objective 16 of Agenda 2030, countries have a responsibility, and this is an ethical responsibility, to promote peaceful and inclusive societies that are working towards sustainable development. We have left behind a legacy of pain and suffering in our country. Colombians are conscious of the future's challenges. We do hope to be able to become an example for the world in the construction of peace and progress in public health. This must be achieved. Thank you very much.
Thank you very much. I give the floor to the delegate of South Africa, and I invite the delegate of Norway to come to the rostrum.
President of the Assembly, the Director General, Dr. Margaret Chan, fellow members and heads of delegations, distinguished ladies and gentlemen, South Africa would like to join the rest of the world in condemning with the strongest terms possible the attacks that took place in Manchester. We pledge our total solidarity with the British people in this regard. Our heartfelt condolences go to the UK government and the families of the victims. Let me congratulate you, Professor Veronica Skotsova, on your appointment as the President of the 70th session of the World Health Assembly. I would also like to thank Dr. Margaret Chan for her address. She has taken us through an overview of the work of the World Health Organization in the last year, and as outgoing Director General, she has given an impressive overview of the achievements and challenges experienced during the tenure as DG over the last 10 years, as reflected in the review entitled Healthier, Safer, Fairer, the 10-year journey, 2007 to 2017. As we have come to expect, she has reflected in most objective manner, taking full accountability of the challenges experienced. Thank you, Dr. Chan, for your passion, compassion, and dedication to global health and your support to countries in Africa in particular. The World Health Organization and the world learned valuable lessons from the Ebola outbreak. WHO is better prepared today. As a result, the Ebola outbreak illustrated anew the importance of strong health systems, including the need for health workers and surveillance. It also emphasized the importance of fully implementing the requirements of the international health regulations. Dr. Chan's review of a 10-year tenure as DG of the World Health Organization highlights our achievement in a number of areas. Maternal and child mortality rates have fallen in most parts of the world, and consequently, life expectancy has increased. However, inequalities still exist between and within countries. Dr. Chan has been alive to these continuing inequities and hence has fully supported the inclusion of universal coverage in the Sustainable Development Goals. She noted the following to this assembly in 2012, and I open quotes: universal health coverage is the single most powerful concept that public health has to offer. Universal coverage is relevant to every person on this planet. It is a powerful equalizer that abolishes distinctions between the rich and the poor, the privileged and the marginalized, the young and the old, ethnic groups, and women and men. Universal health coverage is the best way to cement the gains made in the previous decade. It is the ultimate expression of fairness, close quotes. To realize universal health coverage as well as to meet the Sustainable Development Goals, it is critical that we strengthen health systems, in particular primary health care. We fully agree with Dr. Chan that when she said we cannot treat our way out of these diseases, this means that we must focus on preventing diseases and promoting health. In this regard, we wish to argue strongly for the building of a cadre of community health workers, especially in Africa. This does not represent low-cost health care, as some uninformed people tend to think, but an appropriate investment in human resources for health, as noted in the report on High-Level Commission on Health, Employment and Economic Growth endorsed by the United Nations in September 2016. According to UNAIDS, Africa alone will benefit significantly from employing 2 million community health workers over the next 10 years. South Africa fully endorses the World Health Organization role as the premier global health institution, which must be supported and whose integrity must be protected at all costs, including as advised by Dr. Chen in her address, in our dealing with non-state actors, in particular the food, pharmaceutical, beverage, tobacco, and alcohol industries. In conclusion, I wish to thank again Dr. Chan for her immense contribution to the global health and wish her well in the next phase of her life. Thank you very much.
Thank you. I now give the floor to the delegate of Norway. and I invite the delegate of the Islamic Republic of Iran to the rostrum.
Honorable President, Director General, distinguished delegates, Norway extends its condolence to the United Kingdom for the attack in Manchester last night. Our thoughts are with you in this difficult day. On her last Health Assembly as Director General, I would first like to say a few words of appreciation to Dr. Margaret Chan. Dr. Chan, for a decade you have served WHO and its member states with passion, loyalty and diligence. You have initiated fundamental change in the way we deal with health crisis, led WHO through a period of comprehensive reform and been a strong advocate for universal health coverage and the need of a whole of government approach to improving the health of populations. I want to thank you for being a visible and clear champion for global health. President, today we will elect Dr. Chan's successor. Whoever we elect will face a high number of important challenges. Based on the experience of the latest year, the way WHO perform in crisis will be intensively scrutinized. In times of crisis, the world's eye are upon the DG of WHO. Is WHO prepared to respond efficiently? Do we have the human resources, the medicine and the vaccine? Is WHO a learning organization that always improves? There are good signs indicating that we are on the right track. The reform is working. My main message to the new DG today is that WHO must stay this course. But I also have a message to colleagues. We request WHO to set up a new health emergency program. WHO is doing its part. Now we must also follow through on our commitment and ensure WHO is fully funded for this work. We, the member states, are WHO, its failure and also its success. We need to prepare for a robust global response, but the defense against epidemics will always be strong health systems based on universal health coverage. Universal health coverage is a key target in the context of the SDGs, which we all have committed to. I want to highlight that the UN High-Level Commission on Health, Employment and Economic Growth provided convincing evidence that scaling up the health workforce and achieving universal health coverage not only improve health outcomes, but also leads to economic growth. President, in order to lead the global health agenda, WHO must also build on its comparative advantages, namely its convening power and technical integrity. WHO normative leadership allows others to fill in gaps. The newly established Coalition for Epidemic Preparedness Innovation, CEPI, is an independent public-private coalition for development of new vaccines against epidemics. Norway is privileged to be a founding partner of CEPI together with others. CEPI relies strongly on WHO's normative and coordinating role, while at the same time providing WHO and partners new tools to respond more effectively to outbreaks. To conclude, President, I believe the most important work for the next DT will be to continue the formulation and leadership of health system strengthening agenda, to demonstrate that universal health coverage is needed for all. That means to develop a resilient health system, ensuring no one is left behind, without discrimination based on gender, sexual orientation, religious belief, type of diseases, personal income or place of residence. Norway will always be prepared to support such an agenda. Thank you very much.
Thank you. I now give the floor to the delegate of the Islamic Republic of Iran, and then invite the delegate of Spain to come to the rostrum.
Mr. Chairman, Honorable Ministers, distinguished delegates, allow me at the outset condemn the horrible terrorist attack in Manchester last night and express my deepest sympathy to the families of the victims. I would like to express my sincere appreciation on the occasion on 70th Assembly focused on building better system for health in the age of sustainable development. Following WHA's 68 discussion on resilient health system, the importance of this debate at the time of leadership change in WHO is clear. We live in a very uncertain world with a great number of natural and man-made threats. Better health system is a nation-building strategy to stabilize countries. Ladies and gentlemen, building better system for health is different from establishing a better health system. This is a difference between the prestigious era of global health governance versus the novel notion of governance for global health, which is necessary to materialize 2030 agenda. High-level political attention to intersectoral collaboration, global solidarity, peace, education, and women's empowerment is essential to ensure that no one is left behind from health services. UHC is the key concept to reflect the spirit of sustainable development, so all of society wins in the end. Distinguished delegates, Islamic Republic of Iran is fully committed to Sustainable Development Agenda of 2030, enjoying highest political commitment to health ever. Iran has undertaken substantial governance reforms to establish better system for health. Iran is among countries that showcase effort to implement Agenda 2030, such as Health Transformation Plan to reach UHC and NCD National Action Plan at the HLPF later this year. Details of our activities were thoroughly discussed in the side event yesterday. Respected colleagues, 2030 Agenda requires greater political attention to prioritize health by heads of states. Innovative and country-specific governance mechanisms need to be in place to accelerate meaningful multi-sectoral cooperation and address social determinants of health within citizen-oriented societies. WHO role is to equip member states with technical evidence to design and apply contextual reforms toward building better system for health and facilitating transferable lessons among member states. I sincerely wish that discussion within WHA 70 will contribute to member states' commitment to build better system for health to guarantee the implementation of SDGs for transforming our world for the better. Thank you very much.
Thank you. I give the floor to the delegate of Spain, and I invite the delegate of Saudi Arabia to come to the rostrum.
Thank you. Muchas gracias.
Thank you very much, President. At the outset, Spain would like to, of course, be in alignment by the statement made by Malta. We would also like to congratulate Dr. Margaret Chan for all the work that she has carried out at the WHO during the past 11 years. Today it is very important. Today is a very important day because we are electing a new Director General, and we hope that they will be able to continue the excellent work that has been carried out in the past few years. The challenges that are very different depending on the country on which we focus, but the prevention of illnesses, better diagnostics, and illnesses are common challenges that we must all focus on. It will be very difficult if our citizens suffer from all these illnesses. It will be very difficult to realize full prosperity in our countries, and therefore we must focus on health problems that our citizens have. And to be able to work in the most efficient way possible, we must work in a coordinated manner. We must work together under leadership of the WHO. To be able to coordinate ourselves better, we must improve transparency amongst all of our different countries. If we share challenges and if we want to work in a coordinated manner, then there must be transparency. Only in this way will we be able to use all the resources that we have available to us and be able to attain positive results. Our citizens will be very grateful for all of us to be able to work together under this leadership of the WHO. This framework is irreplaceable. We must all work on prevention as well. New technologies play a fundamental role because they help us to improve diagnostics as well as treatment and give us a better quality of life. It is absolutely essential to look at vaccinations as well to be able to ensure that is prevention throughout the life course, not only during childhood and in older citizens, but throughout the life course. We also must highlight illnesses that are very numerous, such as heart disease and degenerative diseases, where we need to have more effective therapies implemented. We must also work together and to be able to face new health emergencies that come from the spread of a virus. There is only one way to fight efficiently against this, with the leadership of the WHO, with coordination and through communication. Now, secondly, the adequate use of antibiotics. We're very concerned with this, to be able to avoid antimicrobial resistance, which is a very complex issue of public health, and that in very few years, if we are capable to invert to the trend, then this will be one of the main causes of mortality around the world. To be able to face all of these challenges, it is absolutely primordial for all of us to work together to be able to ensure access of our citizens to assistance and care whenever they need it, without leaving anybody behind. We must also ensure all of this to have a sustainability of our healthcare system. With more investment in research and development, especially research and development in antibiotics, maybe all of these challenges will be able to be met. We must look at the viability of our systems in the next few years. We need to have dedicated budgets, as well as to ensuring additional funds. We will have possibilities this way to be able to offer a satisfactory, cross-cutting solutions to the social to the social needs of our countries. In Spain, our national health system is a gold standard mirror in which many countries look at themselves in, and they decide to try to follow Spain's model. Spain has a model that is a universal health care coverage model. It is recognized by Eurostat and has been reported in many different international publications as being a model system. It is really at the cutting edge in terms of training of professionals, as well as organ donations and biomedical research. We have a system that is based on solidarity, and that is based on taxes for its funding. More than 74,000 patients in Spain have been treated with innovative treatment for hepatitis C. This is a system that is always available to cooperate with other countries, which we have already demonstrated with the transplants and by promoting new guidelines for Ebola and hepatitis C, as well as new initiatives such as international medical team of researchers. We really want to play a primordial role in international healthcare. We have an important role to play in Mediterranean, in Europe, as well as in the world, because we have a very good system. We have a lot to bring to the table. We have many different professionals working in this area, and we would like to work together in the construction of a better health system with all. We need to ensure that all of our efforts are coordinated and led forward by the WHO. We need to ensure that the healthcare needs of patients around the world are met. Thank you.
I give the floor to the delegate of Saudi Arabia, and I invite the delegate of Lithuania to come to the rostrum.
Bismillah ar-Rahman ar-Rahim. First, I would like to express my deep sympathies and condolences to the families of the victims of the attack in Manchester, United Kingdom. Every year, the Kingdom of Saudi Arabia receives almost 2 million pilgrims from all over the world during Hajj season. There is also a continuous flow of up to 400,000 visitors per month throughout the year to perform Umrah. In addition, the expatriates workers constitute about 1/5 of the nation's population. This is a unique setting for Saudi Arabia, which puts us at a higher risk of infectious diseases importation. Outbreaks of infectious diseases during Hajj and Umrah seasons can potentially spread to countries around the world. Therefore, Saudi Arabia has chosen to invest heavily in building a resilient real-time surveillance system for infectious diseases and other potential health hazards during Hajj and Umrah seasons and all year round. The Kingdom issues every year an up-to-date list of health requirements and recommendations for Hajj and Umrah. This includes vaccination requirements, food safety guidelines, and general health advice. The Kingdom has also provided free of charge vaccines and other preventive interventions at the points of entry to ensure adherence to the health requirements. Thankfully, these measures prevented possible outbreaks for the last 2 decades. The Kingdom of Saudi Arabia, like the rest of the world, is undergoing a transition of its national health profile and is directing its focus to chronic non-communicable diseases. Programs geared towards promoting healthy lifestyle, especially amongst youth, and are being launched. We're also working closely with our partners in different government, private, and non-governmental sectors to spread awareness. Public health laws and regulations are being revised and updated regularly to ensure introduction of health in all policies. And the Saudi government is committed to providing free, equitable, and high-quality healthcare services to all citizens. The healthcare transformation in Saudi Arabia addresses universal health coverage through initiatives on access of care, burden of diseases, safety and quality, healthcare financing, human resources, and e-health. With the new model of care, the government will assume a regulatory and monetary function over healthcare. Governance of public health will extend beyond human health to embrace the One Health approach. The cost of healthcare is escalating. The 2030 vision is designed to address these challenges in a comprehensive way while prioritizing the healthcare agenda. It is also a national goal to increase life expectancy to 80 years. The government of Saudi Arabia understands the importance of its regional and global role and is committed to providing support in every possible way. We appreciate the continuing support provided by the World Health Organization in making the relevant assessment and in setting up the needed plans of actions. And finally, I would like to thank the Director General Margaret Chan for all her leadership and support during his tenure in the World Health Organization. Thank you very much.
Thank you very much for your statement. And now invite the delegate of Lithuania to the floor, and I invite the delegate of Turkmenistan to come to the rostrum.
Mr. President, Madam Director General, Honorable Ministers, distinguished delegates, Lithuania would like to express its sincere condolences for all who have suffered from the terrorist attack last night in Manchester. Lithuania fully aligns itself with the statement made by Malta on behalf of EU and its member states. By adopting sustainable development goals and its indicators, countries have already agreed what performance of health systems they want to see. Therefore, the key question today is not what to achieve, but how to achieve the agreed goals and to remove restraints that could prevent systems to reach the global health agenda till 2030. The central principle of the Sustainable Development Agenda is its inclusiveness and priority to ensure health for all members of population, not excluding any group. Nevertheless, the accessibility of healthcare services to all groups of the population and key medicines at a reasonable cost is still an issue. Lithuania is striving for more accessible healthcare services by increasing the universal health coverage for all groups of the population. But there is still a lot to be done yet. As an example, to reduce unreasonable costs of medicines and high out-of-pocket payments. This is one of my personal priorities as the Minister of Health. Health system is dedicated to meet the needs of the patients at the first place, but it will not be achievable without the devoted health workers. In SDGs 3C, we agreed to substantially increase the recruitment, training and retention of the health workforce, but globally we're still confronted with the shortage of health workers and disproportion of its distribution across the different parts of the world. In the context of aging population, Lithuania puts efforts to train the sufficient number new doctors and nurses and create attractive incentives to stay in Lithuania and its rural areas, as well as ensure their high competence. Moreover, as we talk about strengthening health systems, we should not forget the key role of the prevention. Effective and timely prevention can dramatically reduce the burden of diseases from already overcrowded health systems, and it is especially crucial in aging societies. According to SDG 3.5, countries agreed to strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and harmful use of alcohol. The use of alcoholic beverages and smoking are two of the four major health risk factors that contribute to the emergency of a large part of non-communicable diseases. Therefore, Lithuania is ready to pay special attention to the control of the following risk factors. We are committed to reduce the availability of alcohol by increasing taxes, reducing places of selling, and restricting alcohol advertising. The role of the WHO in advocating for the resilient health systems at the international agenda and supporting member states is vital. We acknowledge the importance of the WHO in assisting countries with the global guidance on what works and in reinforcement of the intersectoral cooperation and involvement of different international partners to support and strengthening of health systems. We appreciate this and especially the commitment of our Director General, Margaret Chan. Thank you.
Thank you very much. I now give the floor to the delegate of Turkmenistan, and I invite the delegate of Iceland to come to the rostrum.
President, Your Excellencies, Ministers, Ambassadors, Delegates, ladies and gentlemen. At the outset, on behalf of the Turkmen delegation, I would like to offer our most sincere condolences to Great Britain following the terrorist attack. We stand with the families of the victims and the injured. I would also like to offer our congratulations with the election of the President for the WHO. I would like to congratulate also the General Director, Mark Chen, and express our great satisfaction with the results outlined in the report presented yesterday. We would particularly like to underscore work bolstering safety in healthcare and the new WHO program on outbreaks of illnesses and emergency situations. Readiness is a key precondition for early response to emergency situations in healthcare. Investment in bolstering the quality of basic care systems and surveillance networks create the opportunities to identify such situations far more early and respond to them with greater efficacy. We have all seen that the world continues to face a growing risk of outbreaks of illnesses, epidemics, industrial accidents, natural disasters, and other emergency situations for healthcare, which can rapidly become a threat for global safety and security in healthcare. The international healthcare regulations facilitate cooperation between countries to identify risks and to take measures to contain and combat them. Turkmenistan supports the legitimacy of the international health regulations as the only legal document governing global healthcare safety, and we believe it is urgent that we develop in as many countries as possible urgently greater opportunities to fulfill the IHR. We fully agree with the position that the opportunities for fulfillment of the IHR should be seen as an integral part of a healthcare system and not as an additional secondary component. Working together with the World Health Organization to prepare for large sporting events such as the 5th Asian Games. These will take place in the capital of our country in September of this year, and we expect that more than 60 countries from Asia and neighboring continents will participate. Through this cooperation, we have managed to increase our potential in many areas of the IHR. On the basis of this initiative offered by Margaret Chen, we were able to engage in cooperation. This followed her visit to our country in June of 2014. The healthcare ministry plays a key role in planning and preparing for public safety security planning before, during and after the Asian Games. However, readiness for such mass sporting events require coordination between different parts of the country conducting the games and the organizational committee. In our work, we take as a foundation external audits of the IHR in our country, which was conducted in June 2016, the last time, closely working together with the WHO, and we use these results to compile a roadmap for preparing our healthcare system for emergency situations. In this context, the Turkmenistan Health Ministry has achieved a great deal in ensuring readiness in the public health system for the Asian Games. The next stage was in December 2016 and March 2017, preparing tabletop exercises and simulations to verify the readiness of various agencies in the country for coordination and communication between agencies in advance of the Asian Games. During this work, in practice, we were convinced that intersectoral, interagency cooperation is absolutely vital for fulfilling the IHR and also for ensuring a safe and sustainable future for all. We once again would like to offer our gratitude for the effective and fruitful cooperation in bolstering the potential of our country in fulfilling the IHR. Each country should be able to identify threats of new illnesses and epidemics, rapidly verify information and take the appropriate measures to minimize the impact of illnesses and epidemics on the health of the population and the economy across the world. We support the steps taken by the WHO to reform its work in the responding to emergency situations by creating specific niche programs, and we hope that the World Health Organization will continue to work as a neutral and independent organization, with a focus on people whose lives and health are threatened. Thank you for your attention.
Thank you very much. I now give the floor to the delegate of Iceland, and I invite the delegate of Turkey to come to the rostrum.
Mr. President, Director General, Excellencies, ladies and gentlemen, I would like to start out by condemning the terrible attack in Manchester last night. Our hearts go out to the victims and their families. We express our deepest condolences to our colleagues from the United Kingdom. I am honored to participate in this assembly for the first time as the Minister of Health for Iceland. Since I took office 4 months ago, I have realized the importance of the WHO and its guidance for health and well-being in countries around the world. The 2030 Agenda for Sustainable Development is a very ambitious one. We see the agenda as being supportive of the whole of government and the whole of society approach in promoting and protecting health. As the agenda emphasizes engagement and cooperation of governance in all policy and all sectors. Therefore, the Agenda for Sustainable Development gives us an incentive and an opportunity to build better systems for health and well-being. Mr. President, the mission statement of the new government emphasizes the need of healthcare strategy with a focus on equal access, efficient and safe healthcare delivery, and a vision in all policies. For this purpose, the role and responsibility of different healthcare providers will be better defined, and relations between parties will be evaluated and refined. In Iceland, we have, during the last years, emphasized on improving our healthcare system. A new quality and payment system is being introduced and is expected to improve quality as well as access to care as the first contact point into the healthcare system. To further improve service quality of the primary health, multidisciplinary teamwork will be strengthened by a larger number of psychologists, physiotherapists, nutritionists, and other professionals to better meet the needs of individuals, for example, in relation to mental and lifestyle challenges. In other countries, a special focus on mental health and the elderly is important at all levels. This is important in particular at the primary level, where prevention plays a crucial role, as well as in the support of self-care and independent living. Furthermore, increased emphasis on e-health to enhance both access to care and the quality of care provided. Here the focus is on strengthening e-health in rural areas and on supporting mental health care services by using e-health. Mr. President, in Iceland we strive to create healthy environments to facilitate healthier choices, for example through health promoting community projects that promote health throughout one's lifespan, in cooperation with various partners within municipalities. Health and well-being is also one of the 6 fundamental of education in Iceland on which the curriculum guidelines are based. Mr. President, the importance of reducing inequalities among countries has been explicitly recognized as a goal in the Sustainable Development Agenda. Last year, we launched public health indicators in every health district in Iceland, with the aim to contribute to social development that promotes public health and reduces inequalities in health. Iceland is also committed and continues to promote gender equality and inclusive societies when realizing the 2030 Agenda for Sustainable Development. Mr. President, I would like to conclude by thanking Dr. Margaret Chan for her leadership and dedication to the WHO. I would like to congratulate her successor on his or her election as the new Director General after later today. Thank you for your attention.
Thank you very much. I give the floor to the delegate of Turkey, and I invite the delegate of Poland to come to the rostrum.
Mr. Chairman, Madam Director General, Excellencies, distinguished participants, before I speech, I would like to strongly condemn the heinous terrorist attack which took place in the United Kingdom last night. On behalf of my government, I express my heartfelt condolences to the friendly people of United Kingdom. Once again, we realize that all the countries have a responsibility to stand against terror. Terrorists cannot be segregated into good or bad camps. They are the enemies against all of us. I thank Director General Dr. Margaret Chan for her comprehensive report yesterday, which provided us an overview of the global health issues. Having the particular importance of the election of new DG, the 70th Assembly, with no doubt, will also succeed as the previous ones. I would like to thank to Director General Dr. Chan once more for her contribution to the further development of global collaboration in health and her dedication to the WHO reform. It was a pleasure to witness her endeavor in strengthening the role of the WHO all around the world. Ladies and gentlemen, health systems are the instruments for the provision of accessible and efficient health care for all. I am very pleased to see that WHO focuses on building better health systems in the 70th World Assembly. As policymakers, our ultimate goal should go beyond providing healthcare services, focusing on strengthening our systems in the best possible way. Most of our countries require some recoveries in the system, and some may completely need to transform. Health system transformation cannot be achieved completely overnight. It is a never-ending process and needs to define further goals after each and every achievement. We carried out health transformation program in Turkey between 2003-2013 based on a human-centered approach and successfully have completed the first phase. We achieved universal health coverage throughout the country. We not only reduced mortality and morbidity in communicable diseases, but also decreased the disease burden 4% and this dramatic improvements in all health indicators. Citizen satisfaction increased remarkably from 39 to 75%. The success of the first phase put us further needs and goals that led us design in the second phase. This time, we mainly focused on strengthening healthcare services with specific emphasis on promoting healthy lifestyle while reducing risk factors like smoking, inactivity, and obesity. In secondary care, we prioritized professional healthcare services in hospitals and focused on clinical quality. We have been establishing new facilities mainly through public-private partnership. 30 health campus hospitals with around 42,000 bed capacity in total, with high quality and high technology. 3 of them are already taken into service, and we are planning to complete the whole project by the end of 2022. Distinguished delegates, health is directly and strongly affected by politics. We as leaders of global health should not and cannot ignore political matters. Our responsibilities are not limited to only planning and delivery of healthcare services. We also have to deal with every attempt that threatens human life and health and react more effective. While we are in struggle for saving lives, for instance through immunization programs, we must achieve preventing some diseases, whereas inappropriate policies can kill hundreds of them at once with a single bomb attack, either conventional or chemical, as well with deep sorrow in Syria recently. Even if you vaccinate all children in a territory under attack, You may end up with vaccinated children dying instead of unvaccinated ones at the end. Efforts of best health care end up saving life of some, where the consequences of bad politics kill many. The ones who are lucky to survive become migrants seeking shelter. As you're aware, Turkey hosts more than 3 million refugees with cold and our gas, mostly from Syria. Also observance on that by WHO, all Syrian guests have access to free of charge healthcare services as high quality as Turkish citizens benefit. Since 2002, 25 million to 2012, 25 million medical outpatient examinations and more than 300,000 surgeries have been performed, while more than 200,000 Syrian babies were born in Turkey. I would like to underline that Turkey spent more than $26 billion from its own resources for needs of those under protection. Considering Turkey's efforts as a middle-income country, donor countries and foundations can do much more with a higher sensitivity. Distinguished participants, it's obvious that humanity and global health need much more effort, and WHO is the main instrument platform for these. We need a stronger WHO in terms of governance, financial resources, and advocacy of health for all. Today, 3 highly qualified director candidates will be voted here. I wish success to all 3 candidates and have no doubt that whoever will be elected as new DG will do the best to pave the way for the well-being of humanity. Thank you.
Thank you. I give the floor to the delegate of Poland, and I invite the delegate of Slovenia to come to the rostrum.
Honorable Mr. President, regional directors, excellencies, distinguished participants. As everyone in this hall, I'm shocked with horrifying news coming from Manchester. It is really difficult to say anything in front of such human, stupid, and unexplainable act of terror and violence. I express my strong feelings of solidarity with the victims and their families. Mr. President, Poland would like to align itself with the statement by Malta on behalf of the EU and its member states. Health remains a crucial element of the 2030 Agenda for Sustainable Development, not only because it is one of its goals, but because it is a precondition for achieving all the tasks of the agenda sets. Building resilient and sustainable health systems is a key factor in this process. We appreciate the efforts of WHO and the whole international community to strengthen the global capacity to react quickly and effectively to health threats, to deliver high quality and affordable health services, and to act in an efficient and accountable manner. But strong health systems start at home. Without strong political commitment, cross-sectoral collaboration and increased efforts to ensure universal health coverage, it will not be possible to guarantee a high standard of health services for all and improve health of our citizens. Poland has undertaken several important steps to make this vision a reality. First, we aim at ensuring the coordinated care for a patient. Absence of proper coordination results in frequent overuse of outpatient and inpatient hospital care and consequently in increased waiting times. We want to change it. We plan to depart from paying for a single service in favor of supporting comprehensive care, starting from prevention and treatment and finishing with rehabilitation. In the context of a people-centered care, we believe that patient safety should be given the highest attention. We have been working with WHO for a long time in order to improve the standards related to quality of care, patient safety and risk management. Now we are ready to implement these standards. We are working on the draft act on patient safety and quality of care, which will introduce the system of quality monitoring and assessment in hospitals and will constitute a basis for broader use of professional medical
guidelines and quality indicators. We also plan to increase the role of accreditation in healthcare and to set up the Agency for Quality of Care and Patient Safety. Second, we work on changes in primary healthcare. Poland aims at improving the organization and functioning of the primary healthcare to increase efficiency and ensure coordination with other players within healthcare system. We wish to increase the role of prevention and health education. Each person should be under the care of primary care team, which includes a doctor, a nurse, and a midwife, with the support of other specialists in the fields of public health. Furthermore, we are working on creating the network of hospitals with the aim of improving the coordination of health services delivered by hospitals. This solution will be supported by a new model of financing such services. Last but not least, let us not forget about health professionals, one of the pillars of every healthcare system. Poland regularly assesses the need of adapting health professionals to new roles and changing needs. This includes, inter alia, introducing new medical professions, expanding professional rights and the responsibilities of nurses and midwives, and introducing changes to the specialization training. We appreciate the work of WHO regarding health professionals. The global strategy on human resources for health, Workforce 2030, adopted last year, is one example of this activity. But there are others, such as the WHO Global Code of Practice on the international recruitment of health professionals, which should serve as guidance for all of us present. We urge all relevant stakeholders to abide by the rules set out in this code. Mr. President, Poland is highly committed to strengthening the health system. We are ready to promote WHO's global vision, share our experiences, and also learn from the best. We will pursue further the challenge of achieving sustainable development goals in that respect. Thank you very much for your attention.
Thank you very much for your statement. Before I call the delegate of Slovenia to come to the rostrum, I would like us to suspend item 3 briefly and open agenda item 8 to consider the first report of Committee A, which is contained in document 70/68. The report is not available in hard copy, and I will read it to you now. The report contains one resolution. The text of this resolution is also included in paragraph 6 of document A70/67. The Committee A held its second meeting on the 23rd of May 2017 under the chairmanship of Dr. Hanan Mohamed Al-Kuwari from Qatar. It was decided to recommend to the 70th World Assembly the adoption of the attached resolution relating to the following agenda item 20.3, special arrangements for settlement of arrears, Somalia. Is the Assembly ready to adopt this resolution? I see no objection. The resolution is therefore adopted, and the first report of Committee A is therefore approved. We can now resume our consideration of item 3, and I give the floor to the delegate of Slovenia, and I invite the delegate of Tunisia to come to the rostrum.
Distinguished delegates, ladies and gentlemen, Mr. Chair, Slovenia aligns itself with the EU statement. Agenda 2030 represents a new direction for all of our countries alike, to contribute to the development goals, to confront the challenges of all forms of poverty and inequalities, and to assure that nobody is left behind. We Ministers of Health have an important and decisive role to play. It is on us to bring the importance of strong and sustainable health systems and consideration of health in all public policies high on the agenda of our governments. Although obviously crucial, this is not an easy task. In building stronger systems and more effective policies for health, Slovenia has intentionally increased cooperation with WHO in the last decade. Together with the WHO Euro and European Observatory for Health System and Policies, we have performed thorough analysis of our health system in 2015. The analysis was used as a background for the National Health by 2025, as well as for strengthening primary health care and long-term care in responding to the changing needs of population. By this, we hope to contribute to the implementation of Health 2020 and to the process that has been started in Ljubljana in 1996 and will continue by the third European Ministerial Conference next in Tallinn. Together with WHO Center in Venice, we are developing tools for action to better practice health on the development agenda in local environments. Through the support of the regional director and her team, and through timely provision of international evidence, we have managed this year to adopt one of the most progressive tobacco control legislation in Europe. Slovenia is the 6th country in the world introducing plain packaging. Strong health systems matter, and so do effective policies by which we can reduce the future burden of disease. Last year in November, we have hosted the 7th European Alcohol Policy Conference and satellite events of WHO global and regional offices. The focus was on the implementation of the global strategy and the European Action Plan and on the impact of alcohol policy on the development and health inequalities between and within countries. Slovenia is also taking active part in the initiatives of WHO Euro, such as the Evidence Informative Policy Network and the coalition of partners to strengthening public health capacities and services in Europe. This will no doubt contribute to the further strengthening of our health systems. Let me conclude by stressing the importance of concrete action in realizing the vision and the goals that we all agree upon. In previous years, we have developed within the cooperation in WHO evidence-based policies and good practices to be implemented in our countries. Implementation requires investments and decisions that are often challenged by other sectors and interest groups. In negotiating the health agenda, what matters the most is strong international evidence, data comparisons, availability of best practice, and sound advocacy. In this regard, Slovenia has experienced good cooperation and time support by WHO ever since becoming its member in 1992, so 25 years ago. Thank you.
Thank you very much. I give the floor now to the delegate of Russia, and I invite the delegate of Zambia to come to the rostrum.
Thank you. بسم الله الرحمن الرحيم. السيدة رئيسة الدورة السبعين لجمعية الصحة العالمية.
President of the 70th World Health Assembly, delegates, please allow me to begin by presenting my sincere condolences to the families of the victims of the terrorist attack that took place Day in Manchester. I also align myself with all those speakers who have congratulated Admiral Chan for all of her achievements during her mandate at the head of this august organization, and above all, for all of her efforts to strengthen healthcare systems in order to ensure universal healthcare and support this implementation of Sustainable Development Goals. Since its independence, Tunisia has prioritized development of healthcare, invested in the healthcare of citizens, and the development of a healthcare system. Our new constitution dictates that healthcare are a right of all citizens. But we need to fulfill this right. Tunisia has therefore worked to build up our capacity to provide the best healthcare as well as free healthcare for those who do not have sufficient income. We now have 92% coverage. 70% of those people benefit from a special social security fund for healthcare, and 28% benefit from free healthcare. The World Health Organization has always been our partner. It has always helped us, aided in implementing programs to achieve universal health care coverage. But today is a major challenge. This is achieving the Sustainable Development Goals by 2030. This will require a multi-sectoral approach. Our first priority here is a preventive healthcare policy. Such preventative policies strengthen healthcare in general, notably for infants, adolescents, mothers, and also meet fighting both communicable and non-communicable diseases. All of these healthcare challenges together account for 80% of deaths in Tunisia, including diabetes, cardiovascular disease also. Tunisia, therefore, offers free medication for patients of diabetes and also high blood pressure. We also have programs for hepatitis C, and we provide free medication for all patients who need such medication. As regards the international health regulations, we have a national plan to tackle a number of diseases for capacity building and to work with new illnesses which appear and spread rapidly. This also targets epidemics. In our own health regulations, Tunisia is attempting to boost the quality of our health services. We have special centers which are specialized in particular areas and offer family medicine and other areas of medicine with an emphasis on preventative medicine. We have a development network for exchange of data on the international level concerning all epidemics and new diseases. The goal is to effectively fight these new illnesses and spread rapidly with the overall goal of health safety for our populations. So we are conducting reforms with the goal of ensuring that all persons concerned work in the same direction, and Tunisia is now entering into a second phase of a society dialogue on healthcare. This benefits from technical and financial assistance from the WHO as well as assistance from the European Union. In conclusion, I would like to reaffirm before you that Tunisia is fully committed to the position laid out by the Arab Council of Ministers, the statement read out by the Kuwait Minister for Healthcare. I would like to commend all the regional bureau of WHO in Africa, as well as all heads of state who have provided us assistance, allowing us to boost our healthcare and provide free medication. This has made it possible for us also to combat counterfeit medication. We thank the WHO for all of its efforts aimed at improving the quality of the healthcare we can provide and deepening the cooperation between all stakeholders here with an overarching goal of achieving universal healthcare. We stand in solidarity with all countries who suffer from conflicts and natural disasters. Thank you for your attention.
Thank you.
Monsieur le Président,
President, Director General of the World Health Organization, Ministers, ladies and gentlemen. At the outset, on behalf of Gabon, I would like to add my voice to the international community to strongly condemn the Manchester terrorist attack and support morally the British people who have been tested by this barbaric act. It is a great pleasure at the same time for me to take the floor before this assembly to share the experience of Gabon in the implementation of better healthcare systems to achieve sustainable development. Before continuing, I would like to pay a well-earned tribute to Madam Margaret Chan for the remarkable and admirable work she has done during her past 2 mandates at the head of the World Health Organization. She has allowed our institution to effectively respond to international healthcare challenges. President, ladies and gentlemen, as we all know, Sustainable Development Goal 3 for the 2030 Development Agenda aims at giving individuals the opportunity to live a good life for the benefit of all ages. For Gabon, we wish to build on these achievements. For many years, my country has undertaken far-reaching reforms in order to improve our healthcare system to better respond to the needs of our population. Indeed, the Gabon healthcare system consists of 3 sectors: the public sector with civil and military components, the para-public system, and the lucrative and profitable and non-profitable private sectors and traditional healthcare. The public sector is a pyramid structure of 3 levels: peripheral, intermediary, and central. Gabon has a national healthcare policy and a national development system for the 2007-2021 period. We also track mobility and mortality indicators, and since 2010 we have had a system for accountability in spending per patient, and this is a major decision-making tool. Gabon has focused its reforms on 3 areas since the 2000s. First, primary and preventative healthcare. Second, social health insurance. And third, building infrastructure and modernizing our technical resources. We have a 66% rate of national coverage in infrastructure. We have 1 midwife for 823 people in the country. Development of health infrastructure through the construction of 7 regional hospitals, a cancer institute and 4 university hospitals, provide cancerology, mother and child healthcare, traumatology, medicine, but also life-threatening surgery. This structure has greatly boosted the care that we can offer and boosted the quality of care for patients. We also have a plan for the development of human resources to meet the challenges and needs of the system. Despite this progress, a great deal still needs to be done to strengthen our primary level infrastructure in our healthcare pyramid, that is, department, hospitals, healthcare centers, and dispensaries, as well as preventive healthcare. Since 2007, Gabon has put in place a health insurance system to make it affordable for the population to purchase healthcare. This covers 65% of the population of the country, 70% of whom are economically challenged people of Gabon. People in Gabon, the impoverished, benefit from the same healthcare as others, their dependents also. The national insurance system pays 100% for birth, dialysis and cancer, and pays 90% of the cost of long-term treatment for diabetes, vascular disease, and others. The government also has a free antiretroviral drug system and anti-TB drugs for all sufferers. All of these approaches have made it possible for Gabon to boost equality and significantly reduce household spending, bringing them down from 40% of the total healthcare spending in 2000 to 21% in 2015. We want to have a resilient healthcare system capable of resisting external such as catastrophes, urgency healthcare systems, situations, public healthcare problems and epidemics. Gabon to undertaking reform of our national healthcare system in the eGabon project to be implemented by 2021, providing reliable digital information, making it possible to rapidly respond to healthcare situations and better organizing our response. President, these are the hopes of Gabon, which I wanted to share with this august assembly, and I thank you.
Thank you very much. I now give the floor to the delegates of Mali, and I invite the delegates of Lebanon to come to the rostrum.
Merci, Monsieur le Président.
Thank you, President. President, please allow me also to congratulate you on your brilliant nomination to the presidency of this august assembly. President, outgoing Director General, ladies and gentlemen, a new Director General, ministers, distinguished delegates. Like my colleague representing Tunisia, I would like to offer my most sincere condolences to the victims of the terrorist attack in Great Britain yesterday evening. Please allow me, President, to also congratulate you and also congratulate all the members of your Bureau. On behalf of the President of the Republic of Mali, His Excellency Ibrahim Boubacar Keïta, I would like to thank Dr. Margaret Chan for the excellent work of high quality that she has done throughout her mandate at the head of the World Health Organization, in a context particularly loaded with major challenges. However, great results have been achieved. I would like here to bear testimony to the gratitude of the people of Mali. I also wish you every happiness and success in your future activities. With respect to the quality of the three candidates, we are persuaded that the new General Director will continue work on the major challenges that we face. That new Director General will be able to count on the full support and cooperation of the government of Mali. We place great hopes in the reforms of this organization with the goal of greater efficiency in containing urgent healthcare situations, as well as boosting funding for healthcare, notably within our respective countries. This will make a major contribution in a sustainable way to strengthening our healthcare systems and helping us move forward towards the goal of universal healthcare coverage. President, delegates, I would like to thank you for the choice of the theme of this 70th session of the World Health Assembly, building better systems in the era of sustainable development. This falls neatly in line with the Sustainable Development Goals and the concerns of my own country. I would like to take this opportunity to underscore once again our shared concern with respect to the continued appearance of epidemics which heavily impact the functioning of our healthcare systems. The implementation of healthcare development is challenged greatly by the survival of these epidemics. Successive hemorrhagic fever epidemics have revealed that the weaknesses of our healthcare systems in our countries. Therefore, we need to overhaul healthcare mechanisms, including every component and every aspect. In this logic, at the level of each country, robust teams must be pre-positioned in order that they can be deployed in a timely fashion at the national, regional and international levels. This should be duplicated with a surveillance system strengthened by smooth cooperation with research institutions at the local, regional and international levels. President, delegates, I would like to call this assembly to pay attention to the following key issues. Support for countries to ensure the appropriate approach with respect to the availability of human resources, well motivated, trained and committed to ensure universal health care and provide the necessary care. Making quality health care affordable to all of our populations. Prioritizing maternal, infant and adolescent health care. Institutionalizing and facilitating urgent healthcare management at all levels, making available vaccine stocks in order to intervene adequately, notably in high-risk countries, promoting innovational research in prevention, diagnosis and care, making the concept single health a key lever to assure effective management of urgent health care and contain epidemics. To conclude, I would also like to place a particular emphasis on the peace and security dimension. This is a sine qua non precondition of all development and notably social healthcare development. Thank you.
Thank you, Mali. I now give the floor to the delegates of Lebanon, and I invite the delegates of Ukraine to come to the rostrum.
Thank you, President. First of all, I would like to express in the name of the government of Lebanon our condolences to the United Kingdom for the human losses after the terrorist attack in Manchester. And before starting my statement, which will be provided in full version to the record, I would like to express all my government's appreciation and gratitude to Dr. Margaret Chan, for the valuable support she always provided to Lebanon and for leading the WHO towards success in the spirit of collaboration. Mr. President of the WHA Assembly, distinguished colleagues, it gives me a great pleasure to address this distinguished assembly on the topic of Sustainable Development Goals. The UN Agenda for Sustainable Development sets global goals and targets that would shape health policies of all member states. The SDGs represent also a framework of accountability for political leaders. Thus, the SDG indicators represent a tool to assess governments' fulfillment of their commitments to the world and to their populations. In Lebanon, and despite the massive influx of displaced Syrians resulting in a sudden increase of the population by 30%, we successfully reached the MDG health-related targets on time. The emphasis is now on maintaining this achievement while directing the interest towards universal health coverage. In view of the protracted Syrian crisis and its continuous serious repercussions on the Lebanese health system, we are now focusing on addressing discrepancies within and among regions aggravated by this crisis. Thus, we adjusted our sails towards building a strategy that takes into consideration the response to crisis while upgrading services to meet the new challenges. With 38% of our hospital births are for Syrian refugees, we have to consider that the 1.5 million that entered Lebanon as influx in the peak of the conflict are now increasing with a general fertility rate of 165 per 1,000 women as compared to a GFR of 59 for the Lebanese population, which poses serious threats on the demographic profile of the country. The health system is severely strained by the significant increase of demand, and we have serious concerns about the country's ability to continue ensuring access of the displaced to health services, considering the shortage of funding from the international community. Moreover, strong health systems are needed to sustain MDG's achievements, accomplishing SDGs, and make progress toward universal health coverage. Resilient health system is required to face epidemics, massive people's displacements, and other emergencies. Health system resilience is hence rightfully considered as a global public good. Strengthening health systems remains the major contributor to all targets and critical for their achievement, and most of all for sustainability. How to integrate new technologies is essential to enhance the efficiency of different health system building blocks. Information system is the cornerstone to generate information for evidence-based policy and provide needed data for indicators measurements. It is therefore crucial for transparency and accountability. At data management level, Lebanon is embarking on an e-government approach which will provide the right platform for monitoring and evaluation of all multi-sectoral development plans. Lebanon has achieved a meaningful progress towards universal health coverage. Every citizen is currently entitled to primary health care and hospital care coverage, while households pay less than 8% of their total spending on health. With a strong private sector and active civil society organizations, the multiplicity of providers and covering agencies in Lebanon has played an important role in the resilience of our health system. Good governance based on networking with health actors was behind mitigating fragmentation while benefiting from the diversity of the health system. We believe that the SDG era is fundamental for WHO's repositionings in its reform agenda. We therefore thank the WHO for its continuous valuable collaboration and call upon its leading role in technical support to improve country capacity and build resilient health systems. I thank you.
Thank you, Lebanon. I now give the floor to the delegates of Ukraine, and I invite the delegates of Honduras to come to the rostrum.
Dear Chair, distinguished ministers, excellencies, ladies and gentlemen, I must reiterate our delegation's opposition to the placement of the representative of the Russian Federation to the position of President of the Assembly. Despite this, it's an honor for me to address the Assembly today on behalf of Ukraine, one of the founding member states of the United Nations. First of all, I'd like to thank Dr. Chan for the magnificent work she's done at the post of Director General, her personal commitment and dedication. Under Dr. Chan's leadership, global health indeed has made great progress. I hope that her successor will further develop the legacy she's leaving behind her, continuing, among other things, the major reform process will render the organization better prepared to face current and future challenges for global health. Since the WHO's inception 70 years ago, the world has dramatically changed. It has become more insecure and vulnerable to hybrid threats, as evidenced by the heinous terrorist attack in Manchester. This situation directly affects, among other things, the health dimension. For instance, as regards to Ukraine, for almost 4 years now, innocent men, women, and children, and the elderly have died as a result of Russia's war against Ukraine. Its impact on Ukraine's population has been felt far wider than the occupied territories of my country. The government of Ukraine, and in my case, the Ministry of Health, is unable to provide any health services whatsoever to the millions of Ukrainian citizens remaining trapped under Russian occupation. Many of my fellow ministers understand the painful and costly burden that war can bring to the public health system. Ministers from Pakistan, Afghanistan, Turkey, and elsewhere able to provide any health services whatsoever to the millions of Ukrainian citizens remaining trapped under Russian occupation. My fellow ministers understand the painful and costly burden that war can bring to the public health system. Ministers from Pakistan, Afghanistan, Turkey, and elsewhere know very well the challenges of preventing outbreaks of diseases when millions of people are internally displaced, unreachable by static health centers. The failure of the Russian occupation and its proxy forces to adhere to the Minsk agreements is well documented, with almost 500 kilometers of the Ukrainian border exclusively under control of Russia and its proxies. The aggressor state continues to supply increasing amounts of sophisticated weaponry. As you recall, the tragedy of MH17 on July 17, 2014 was a direct result of such weapons deployment. And they continue to shell innocent civilians with inhumane abandon, killing more than 10,000 people. 1 in 5 schools has been damaged or destroyed. In defiance of the UN Security Council Resolution 2286, many health facilities have been hit by shells several times. Healthcare workers have been taken hostage, wounded, and killed. In the Russian-occupied region of Luhansk Oblast, the situation has returned to the dark ages, with health policies copied from the Russian Federation. There are credible reports that antiretroviral and tuberculosis treatment is unavailable. The only source is delivery by smugglers. There's a dangerous of detailed data-derived insights into the child health, immunization, vaccine, and polio status in the areas experiencing the most intense conflict. The UN estimates that mines are strewn across at least 30,000 hectares of land, or 300 square kilometers, far beyond the reach of current limited clearance efforts. Landmines and unexploded ordnance have killed more than 600 soldiers and civilians, including dozens of children, and wounded more than 2,000, including a young boy in Luhansk just days ago. And I remind you what Dr. Chan said at the previous assembly. Armed conflicts in faraway places will not stay remote. What happens in my neighborhood affects your neighborhood. Very few health or security threats are local anymore. As long as Russia continues to wage an illegal occupation and war, pay a price for its actions. That's why I call upon all of you, fellow ministers, to encourage your governments to support strengthening and expanding sanctions against the Russian Federation. Its gross violation of the Minsk agreements and international law needs to be met with the strongest resolve possible. Ladies and gentlemen, today Ukraine is an open and transparent country. More has been done to reform it in the past 3 years than in the previous 23. This includes upgrading our ability to stop the spread of preventable diseases such as polio and measles by improving vaccine supply, changing protocols, and upgrading disease surveillance and response. Much of this has been done in cooperation with our international partners. Until recently, Ukraine had one of the lowest immunization rates in the world, as low as 14% in mid-2015 for polio. However, a nationwide polio campaign in 2015 and 16 have helped boost coverage, and the new procurement practices will ensure against vaccine stockouts. While social media platforms can be effective channels for delivery of accurate and positive information, they are often also used as a mass forum for the communication of disinformation about the desirability and safety of vaccines. We need to enhance our cooperation to counter such efforts. For the first time in 25 years, key reforms ready to be passed by the Ukrainian parliament will finally give Ukrainians a public health system that meets international standards, uses international protocols, and empowers the patient. And yet, vested interests with support from foreign elements are trying to block these reforms from being passed in the Ukrainian parliament. The adoption of these draft laws is extremely important, especially for the most vulnerable who need access to quality health care. We do not have the luxury to wait another 5 years before any of these reforms take effect. We are thankful for the support and cooperation of the World Health Organization. Your work is having a positive effect in Ukraine. However, we would also welcome more efforts to bring streamlined procedures and more rapid implementation. Ladies and gentlemen, the Euromaidan Revolution of Dignity in the winter of 2013 and 2014 was only the first step. Building a new Ukrainian healthcare system that provides equal access to quality healthcare is next step in a process of building Ukraine free from foreign intervention. Due to decades of corruption and neglect, Ukraine is a nation with a declining population, low life expectancy, and a declining birth rate. No health minister can drive change alone. I would appreciate, dear colleagues, your further active engagement and cooperation with all branches of the Ukrainian government to ensure the implementation of much-needed healthcare reforms. Ukrainians cannot wait another half-decade. Thank you for your support to help us move Ukraine and global health forward. Thank you.
Thank you, Ukraine. I now give the floor to the delegates of Honduras.
Muy buenos días. Good morning to all. Dear Mr. Chair and distinguished members of the Bureau, dear ministers of health, ladies and gentlemen, dear delegates of the member states of the WHO, it is an honor for me to speak to you at the 70th World Health Assembly, which is the supreme decision-making body of the World Health Organization. I would like to take this opportunity to express our condolences for the attack in Manchester last night. As every year, this opportunity is an auspicious opportunity to be able to decide on the policies of the organization, oversee the financial strategies underway, and to adopt the annual budget. Likewise, during this WHO, we will also elect the new Director General of the World Health Organization, who will have the great challenge of fostering better spaces for cooperation and managing efforts deployed within the WHO to facilitate and speed up the realization of the Sustainable Development Goals of the nations by the year 2030. This focus on sustainability requires from countries to have a more holistic approach that incorporates social and environmental approaches to development. It must also be present on political agendas and programmatic agendas that we are responsible for as health officials in our countries. In this vein, the government of Honduras, as well as our Ministry for Health, are committed to ensuring a healthy life and to promoting the well-being of all, as is set out in SDG 3, Health and Well-Being. In line with this holistic approach, we have initiated a reform of the health system, which is increasing coverage as well as the quality of health care to reach the most disadvantaged people in our country, with the opening up of new hospitals and health centers, as well as the broadening of this process of decentralization. We are also carrying out monitoring activities in the trade and economic area, which is part of the interinstitutional platforms that have been established to address problems of health problems that are important at the national level. To do this, we are consolidating the roles of stewardship as well as regulation at the Ministry for Health, and we are overseeing the diverging modalities of decentralized healthcare. We are also driving modernization of the management of medication and other products. Besides all the advances that we have made in our health system, this era of sustainable development also requires the development as well as the leadership that is able to align itself with the national strategies based on SDG. Only in this way will our health systems be able to be resilient and have the capacity to realize the sustainable development goals by 2030. Therefore, I would like to take advantage of this opportunity to express our gratitude for the continuous unconditional support of friendly and international institutions, especially the people of China, Taipei, for the historical support at crucial moments of our history in their help with worldwide epidemics and now in the achievement of the 2030 agenda. We hope that they will continue their support in the future, and we would like to thank Dr. Margaret Chan for her legacy to future generations. Thank you very much.
This ends our consideration for item 3 for today. Before we conclude our work for this morning, I should like to inform you that the Assembly Hall will be set up and reorganized for the Director General election this afternoon, and access to the room will not be possible during the lunch break. I would like to ask all delegates to leave the room of this meeting. The doors located at the back of the Assembly Hall will be reopened at 13:30, and access will be restricted to the delegates wearing their country badges, which are currently being distributed near the back doors. Please remember that access to the Assembly Hall during the Director General election session will only be possible through the doors at the back of the room. It is now time to adjourn this morning's session. The Assembly will meet again at 1400 in plenary in private session to continue its consideration of item 4, post of Director General. The meeting is now adjourned.
That's great. So, call your assistants if
trade